Think about all those poor women who suffer.
Exactly, exactly. Mood swings and depression are common symptoms of menopause, and many prescribers are very quick to grab the pad and write a script for antidepressants. But could the very medication meant to help you actually be hurting you? That's today on Second Act TV. Well, we're back in studio talking to Dr. Laurie. If you didn't see our first segment, Dr. Laurie is my personal physician. She's an anti-aging and hormone specialist, and today's topic is menopause, depression, and antidepressants. So, yeah, it's obviously one of the big symptoms of menopause is depression. Tell us about that. What do you see in your practice?
You know, it's pretty amazing how often I do see it. And really, I would say it's a good 30–40% of the patients I see, men and women, not just the women, but we're talking menopause. And it's just amazing to me how easy it is for these patients to be on antidepressants. So, you know, they go see their doctor. You know, their doctors are busy, they see 50 patients a day because they don't have the specialty practice I have, and they basically get put on antidepressants because they didn't feel good, they're under the weather, they're blue, and they're not truly clinically depressed.
Well, I remember even in my late 30s, and I was probably perimenopausal, early 40s, you know, just seeing my physician and said something about feeling down a little bit, and he goes, well, would you like me to write you antidepressant? And I'm going, you know, no. And then 6 months later, I was on it. I tried them, and it had significant impact on my libido, which is one of the things we want to talk about today.
Right. So a lot of these women, so hormone changes obviously can impact mood. We've established that, and all of you listeners, you understand that now. So you get on an antidepressant for the wrong reasons. So not only does it blunt your libido, but it can also take away the joy, blunt your affect, where you're just kind of flat. So you go from where you're hormonal up and down, which you do want to affect, but with hormone balancing, you're going to be more normal because you want to have up and down. But so the antidepressants, they blunt your joy, your desire, you know, and also for sex, obviously, but just in life, you know.
So they take away the lows, but they also take away the highs.
Right.
And I felt that, yeah. And I've heard a disturbing thing that, or to me it was disturbing when I was doing some research, is that antidepressants are actually being prescribed by some for hot flashes.
Right, that seems
and
crazy.
And the women don't even realize that it's antidepressants.
Yeah, it's absolutely crazy because there's so many side effects. It's hard to get off, and a lot of the ones that they use, when you stop them, you feel like you have the flu. So you really don't even want to start them to begin with. So it really is just the wrong way to treat hot flashes, because why would you fix the symptom and not fix the cause?
Yeah, right. Well, and the cause being hormones.
Correct.
Yeah, which I know, I mean, you know, obviously, you know, everybody knows I'm bioidentical, have been balanced, and it's made a huge difference.
Right, and you don't need to be on antidepressants, right?
No.
In fact, you know, I have successfully gotten patients off the antidepressants, which is fabulous. In fact, a friend of yours that I saw.
Yes.
And amazing success story, and I love it. I can't tell you how many women have cried in my office because they look at me and say, thank you for telling me I'm not crazy. You know, to realize that they're not crazy. There's not something wrong with them that's unfixable. You know, so because once you balance the hormones, they feel good, they feel themselves, and lo and behold, they don't need those medicines.
Yeah. Well, I'm glad you brought up Karen, because you know she is here today and talk, because she's willing to talk about it. Lots of women, you know, are hesitant. So that's part of what we do on Second Act TV. We you know, bring stuff up that other people don't want to talk about to hopefully help other people who are in that same situation. So anyway, thank you. Again, the key points for our viewers before you get on antidepressants.
Right, check your hormones, and especially if you're between the age of 35 and 55, that is the key age group. But even before, after, I mean, you're never too old or young to get your hormones checked and get them balanced. What does it hurt?
Exactly. Thanks for tuning in again today on Second Act TV. If you currently feeling, you know, the way I did, a little moody, you're feeling depressed, you're feeling down, don't grab the antidepressants right away. Find a physician that understands the importance of balancing your hormones and see if that helps you first before you take a more drastic step. We hope to see you next time.